Morning. Good afternoon, everyone, and welcome to day 2 of SILC annual meeting. Dawn, could you take roll?
Sure thing. This is Dawn Lyons, okay? Taking roll call. Julie Steinbach,
Here.
Sabra McWhorter Clark. She did say she may be a little bit late today. Margaret Marcucci. Here. Linda Voivoda. I did not see her. Ace Patrick. Here. Dee Dee Formaster. Looks like she might be running a little bit late as well. Mark Tatter. Mark Tatter. I see him here.
Yeah, I think he just finished a group at the
Yeah.
center, so he might be running a little late.
Hello.
Hi, Mark. Thanks.
How you doing? Yeah, I'm trying to, somebody's locked out of their DMV account. I'm trying to fix their, anyway, I'm done. I'm here,
Okay, thank
present.
you. Sheena Childers.
Thursday, July 9th.
Here.
Randall Owen.
Speech off.
I didn't see him. And I think Autumn Blattman is here for Lori Lutu.
Yeah, I'm here, Dawn.
Hi, Autumn. And we have quorum.
Will you read the preamble for the public comment?
Of course. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the beginning and end of each day and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments.
Does anyone have any public comment? You don't see it.
Audio unmuted alert. Meeting tools window.
I don't see anyone for public comment. Randall Owens just
Randall Owens
joined.
has joined the meeting alert.
Okay. It's exactly. It's trying here.
John has not joined us yet that I can see.
Okay, so right now we're on item 70. So let's go to 70. And we'll come back when John arrives.
Okay. So this is Dawn Lyons, and I have to be honest, I was unable, due to some last minute scheduling conflicts, make the last Nevada State Rehab Council meeting. I did make it to a subcommittee meeting on their bylaws, so I was able to help add or contribute some information, and we worked together to kind of establish some new bylaws since they hadn't been really looked at in a long time, and there was some outdated information in them. But maybe on this one, perhaps Sheena, or if you're able to give us a little bit more information on the last Rehab Council meeting, since I couldn't be there, I would greatly appreciate it if you have any information to share.
Sure. Good afternoon. This is Sheena Childers for the record. So our last, let me pull up some notes here. Give me 1 second.
I appreciate you being such a good sport.
Yes, thank you. Mm. You and God, are you ready?
Yeah, I mean, it looks like John is here. If Sheena, if you need a little bit more time to pull that together, and then John can actually do his presentation first now.
That works for me.
Thanks.
Okay, God, are you ready?
You bet.
I'm good.
As ready as I'm going to get.
Okay, the floor is yours.
Thank you very much. John Roseland for the record, Aging Disability Services, primarily the Nevada Assistive Technology Collaborative, and under that, our state's AT for Independent Living program. Common for anybody that's not aware of what that program is, it's been in existence for pretty close to 30 years, as best I can tell. Our role is really that providing using assistive technology to address essential daily living tasks, the things that we have to do every day: bathing, toileting, getting in and out of your home, sometimes wrongfully referred to as the vehicle and home modification program. It is an independent living program defining that independent living goal, steps, independent living plans, all of those pieces. He even has the piece that was built in through the SILC back when the SILC was more involved with this program, to help transition people out of care facilities and, number one, trying to prevent institutionalization. So where our role takes us is really trying to get rid of those barriers to those essential daily living things. And we have some state resources to do that. And then the other part of the program, as you know, I've been reporting for the last year or so about the ARPA funds that we received to eliminate the waiting list and the complications along the way with that. We are out of those funds. We did utilize everything, and I think I've reported before some of the complications. Not like it's going to take. It would probably take years to utilize the funds in an efficient way, because we simply don't have vendors, contractors that can ramp up and take on services the way that we had. You know, we didn't know how much time we would have. Now we have these funds that are being extended like 1 quarter at a time. So having known that, we could have probably managed this a little bit better, but I'm far removed from those conversations as far as getting approval for those funds. We've utilized them completely, and are back to our state general fund allocations that we get. And what that means is we'll move slowly back to that wait list eventually, probably by the end of this year is what it looks like. So that's kind of the overview of the program and kind of what I usually touch on. We did move to a new data system, so I'm not providing the typical report that I have in the past with breakdowns for the number. I do have some goal information, but not the breakdown of the primary goals that we usually set with consumers are in the self-care era. And I'm hoping that we can get some things fixed around in that system and get back to having some really kind of granular data about that, right? Because I think that says a lot when you have a program that's been around this long, and self-care needs are probably still the biggest area that we have that's been unchanged for a number of years. So bear with me as we try to fumble through this system that the state has got us into, and get some better reporting. Dawn, I see your hand up.
Yeah, thanks, John. I was just curious because you were saying you're far removed from the conversations about how the ARPA funding was handled, but I was wondering if you knew anything about if there's any kind of request to replace that additional funding to maintain the wait list status from legislature this upcoming session, or if you have any thoughts about that, or do you know anything?
I don't. I shouldn't say barred from it. That was a bad term on my part. I'm far removed from that. Right there's I don't know how many layers of people there are within our agency, but I'm not one of those seats at the table. And that information comes to me usually probably at the last. I'm probably the last person to know as the program person, and that's a different from where we should be probably. I don't know what those are. I am appreciative that we have been getting these quarterly extensions, and what has been relayed to me is that it's really not the programs that it's definitely not the extension of independent living and that blind services pilot. I say blind services, O&M training that we're trying to. We got some funding set aside for that. That was all in one package. And we're getting this 3-month extension. I'm being told, I guess what I'm getting, I don't know how direct that is from those folks, but they're approving it 1 quarter at a time, and it's not our programs that are the problem. I don't know how many of these ARPA things that existed. I don't know how many projects, grants, whatever you want to. I know we're going to this grant world, but how many actual programs there are. Ours isn't one of them that's like red tagged, like, oh, we're not going to extend this for another year. The problem is trying to plan, right? If we have 3 contractors, I'm talking like building contractors that are, they're booked out through the rest of the year, being able to confirm and commit to certain things. That's hard to do when they might be, they might be 90, 120 days before they start that project. So us committing those funds relies on us being able to have a longer trajectory than 3 months. And initially we had up to a certain point, and we were just planning on the funds getting pulled, right? There was all this conversation that I say conversation. There's all this stuff that I was reading that those funds were kind of being promised to nonprofits, and until you're sitting in those meetings and know what's going on, I don't think that it was clear to me.
That's unfortunate considering the fact that it's supposed to be transparent to the public as well, right?
Well, and maybe as a person in the public, maybe I could participate, but I've got enough on my plate to do that. There should be better communication within our agency, right? I think in my mind, I'm speaking bluntly because that's how I do it, that we should know from top to bottom what's going on and how these things relate to each other. I hope that the things that I put into the report about those challenges, right? This is no different than it was 20 years ago, I'll tell you. If you got an injection of funding, you don't just go out and hire a bunch of contractors and go, hey, we open the door up and we eliminate the waiting list. You can't operate a program with independent living specialists and then go and hire somebody off the street and say, hey, now you're an independent living specialist. So I hope that somebody that is in these decision-making capacities understands the challenges that exist. So right now we have an extension to keep going forward with the blind services pilot through September. So we keep getting these little, like I said, these little bits, and I'll give some reporting on where we're at with that as well. And did I answer your question or just make it much more confusing?
No, you answered it. I don't know if it was the answer I wanted to hear, but I understood your answer.
Well,
thanks.
Yeah, it's one of those things. We're not in the same agency that it was when it was the Office of Disability Services, where I'm just reliving those old good times where there was the Governor's Council on Developmental Disability, all those things were in one roof. So all those plans and the Olmsted plan for Nevada, I mean, all of those things were coordinated in one place, and now it's very fragmented. I mean, the agency is huge now, right? The creating of ADSD has merged all these things, and so there's a lot more people involved, and whether they like to admit it, a lot more silos, because that information doesn't flow freely when there's 12 people in one room. Anyway, back to the independent living stuff. Again, my data stuff is going to be fairly short. I broke it down into just really closure or caseload stuff, but let me pull that back up. I accidentally closed it. As usual, I got too many things up.
That's a question.
Were you opening it up to the public for Stephen to ask a question, Julie?
I keep forgetting he's public. Let's wait. But
I'm ready if we're going forward. Sorry.
Yeah.
Shall I go forward?
Yes.
Okay. So regarding the AT for Independent Living program, this year we have about a caseload, about 183, not about. That's the number I came up with, and I say that about because this new system's wonky, and there are some interesting things that I'm learning about the reporting and if like a plan can be duplicated and then deleted, and sometimes that affects the reporting a little bit. And I don't think it's going to be off very much, but I'm saying don't be writing these down and holding me to them and say, well, on July 9th, John said there was 183 cases. That consisted of there's currently 117 open independent living plans. There's been 66 independent living plans closed. We have 33 pending signature, and that's unusual. That we shouldn't have that many, really. You shouldn't have a plan out sitting there that somebody's not signing and returning. So that one's a red flag for me. But if that's the case, we would be looking at a much larger caseload, and we need to follow up with those because that jumps that up over 216 cases. If it's pending signature and those aren't some fluke in this system and coming up in the reporting, those are all, who knows, that's a number of goals that we're going to have. It's a significant piece of the caseload with 33 more cases added to that. But I'll be able to fill you in on the next what we find in this reporting. Goals. Those independent living cases convert to independent living goals. So of those 183 cases, both the closed and the open, equated to almost 800 goals, 798 goals to be exact. And just kind of go through the quick breakdown. 41% of those are active and in progress. That's means that we're getting solutions put in place, or it's at some point where that goal is going forward. 46%, just over 46%, have been closed out. Excuse me. Let me rephrase that. 58% have been closed out for some reason, right? That's those closed cases, or it could be an active and open plan with closed goals in it too. 46% of the entire goals set there have been met, and then I have a breakdown of the ones that aren't met, and that's withdrawn, passed away, and unable to contact, or if we have no solution available. And sometimes the withdrawn can be a combination of that. A person may decide to withdraw a goal because it doesn't look like there's a resource to pay for that assistive technology. We get about, it's almost 7% of the goals that were closed or withdrawn. Excuse me, 7% of all the goals set. 55 of the 798, if that makes it a better way of explaining it. Unable to contact, around 3%. Those are people that we just can't get a hold of by mail or by phone. And again, 3% of people that passed away. So it's always good to see the 46% of the goals met and only 12% unmet. Estimated cost for the current open goals, that's right around 800,000. So that means going into this new year, we have about it's just over $1 million in funding that's going to be just for those direct services to pay for those modifications or the AT that's needed by the person for that essential independent living goal. That's a kind of a wonky number. And then when I was looking at this data, putting this together, it looked like there's about 267 goals where we don't have an estimated cost yet. That could be because of this new system. It's we kind of got jammed into it pretty quickly last year. We then CareChest wasn't able to access it for 2 to 3 weeks while some things got hashed out about logging in. That was back in November. I think we've got all of that down. We just don't have, I don't have the reporting tools that I usually had, and the independent living specialists don't have some of the reporting that they had. Like we have a report we call the estimated cost report, where they could pull their whole caseload and kind of get that 10,000 foot view, right? How many goals are open and we don't have an estimated cost for, or there's not a solution in place. It's possible to pull this report, but I literally have to pull data together from at least 6 or 7 different reports to make that. And so I can't readily make that for them and hand that out to them. But the good news is I think some of these reports are being prioritized. The big question will be when do we actually get them? So any questions about those caseloads, goals, etc.? And if not, I'm going to jump over to the orientation mobility service that we were able to do with this ARPA funds. And really, I think since the last time I talked to y'all, a lot has changed.
I have a comment.
Okay.
Julie Lanskin, for the record. I discovered that mobility systems is getting into the home modification business. And I wondered if that might be a resource.
Let me see if I got this right, Julie. If somebody has a mobility issue getting into their home,
There's a company that's called Mobility Systems, and they usually deal with beds and bin conversions. But I was told that they're getting into the home modification business.
okay.
And I just wanted you to be aware of that, because maybe that could be a resource for contractors.
Yep. So and it's, unless something changes with the with our agency, Right now, and I would say for almost a decade, we moved the direct service funding out with the community partners. So CareChest actually is able to issue authorizations directly, and that makes a lot of flexibility. Like back in my early time when everything was a purchase order through the state, you had to go through the controller's office. That eliminated it eliminated an option for the consumer. Like if they were looking for a private purchase of already modified van, you might find a smoke and deal, but finding somebody that's going to go and become a vendor for the state of Nevada, that's a private individual, you could just write those off, right? No, who's going to go through all of that and then wait, release the vehicle and wait 60 days to get paid. So it's very flexible. They would just work with CareChest. CareChest would work with them on the requirements. And we try to, just so you all know, we try to assure that there's not like this competitive in the sense of we want all the work. The priority that is established with when we go and meet with consumers to address those issues, those barriers, it is that everybody's thinking together. Your numbers should be one thing, but there's no slipping. Like we used to have contractors, sometimes we had a few of them that would circle back to the person and say, oh, I'll get you the expensive tile or whatever, and it takes the focus away from what the outcome can be sometimes. So I'm just saying it's a very open process. Most of the contractors know each other, they get along with each other, they're bouncing ideas off, and hopefully we can maintain that. So if you do know somebody, Julie, that's in that realm, please even have them reach out to me and I'll help connect them.
Okay, great.
Thank you.
Thank you.
All right, back to the task. There we go. Okay, so in November, we had finally got our contact together with Blind Connect. I know that when the director left, when Raquel left as the director, I don't think that those emails were getting read or anything. And then at some point, I made contact with Gene over there, and we were able to kind of get things rolling. And so back in November, we kind of finally got this pilot project kind of moving. And here's, I'll kind of roughly tell you how it's working. Blind Connect, who has been like the main point of contact in Southern Nevada, they said they get a lot of the referrals when there's no other resource for somebody to get orientation mobility training, that big gap that exists, right? If you're not looking for a vocational goal, or you're not 55 and older, that's where that big gap has existed for many years. And so we reached out to Gene, coordinated with CareChest, and then Blind Connect started reaching out to all the people that they had been in contact with or on their list. And we started tracking these things, a method of screening or talking to people, having that engagement conversation, finding out certain things, like, do they have other potential resources? Are they interested in going forward with orientation mobility training? Blind Connect had an O&M trainer that they were already working with. And then we found somebody that is contracted with VR, but is also doing it on the private side. So we were able to find those two individuals and finally start launching some services. Blind Connect started reaching out to people, and that started, like I said, in November. And we started tracking how many people were, engaged about this. How many people described that they needed O&M? How many people were appropriate for the pilot program, right? Like they don't fit in that 55 and older, and they could get that resource there. The reason why we were trying to focus on if they qualified for something else, the next question is really, why aren't you accessing that? And I'm going to circle back to that because I think there's some information that we really need there to address this on a larger scale. Number of determined appropriate for this pilot. Number of people who are needing O&M but may have other options, and that's that older blind or VR. Number of O&M assessments planned. So what we did is we talked to the O&M specialists, and they started describing what they thought would be a good process and what they were also mirroring over at VR and older blind. And that was first the assessment, right? Somebody says they're interested, then this O&M person's going to go and meet with them specifically and kind of defines what some of those goals are. And then we could move forward with it. CareChest could implement that into the goals in the plan, and really isn't engaging with the consumer as much as the O&M person and the person at Blind Connect. And then the number of assessments completed, how many are pending, and then also we start tracking how many people needed a cane. Because if you remember correctly, this first started off, this whole conversation that led to the ARPA funds kind of being available to do this. It was kind of like a train going out of control. It was all about canes. Like we just need somebody to buy canes, and it really wasn't the cane issue so much. So that's where we kind of want to make sure that, you know, we're kind of proving that the cane issue is not as big as the need for an O&M training. Then we're also tracking the number of trainings completed year to date, how many trainings are in progress, and of course, how many canes total. The one piece that I told you I'd circle back to, and it's on my shoulders that I haven't worked with Gene over there at Blind Connect, but we want to see if we can have them reach back out if they don't understand why somebody's not. Number one, have they had O&M training in the past is one of the things we want to find out. And then why are they not accessing the other resources if they exist? We've had a couple people that almost to that evaluation point that they said we found out that maybe they were already working with older blind or through DEETR. And so that's, I guess, refreshing, but those are people, you know, individuals that we're kind of trying to keep track of, that they are actually working with somebody now. But let me get to the numbers. So year to date, we have 23 people that have been engaged. That's conversations about O&M training. 21 of the 23 described needing O&M training. The number of people determined appropriate for the program, that means that doesn't meet that 55 and older or vocational goal, 8 individuals. Number, of course, it's pretty simple math there. Number of people needing O&M but have another option. That was the remainder of that. So of the 21 people that said they needed it, 8 qualified for our O&M, and then the other 13 that have other options. Number of assessments planned going forward. Excuse me, I'm reading the one that wasn't updated through June. Apologies. Let's start from the top. Number of engaged and screened. Number of people that the conversation's been had is 25. 23 describing needing training. Still 8 appropriate for this program. 14 said that it appears that they have another resource, either VR or older blind. And that could be vocational, or could be like a VA thing too. That's the part we need to kind of dissect with Blind Connect and find out what those other resources might have been. Number of assessments planned. We have two planned, so those would probably lead to training. Number of assessments completed. There's been a total of 8 completed. There's 1 pending, and then so far 6 canes provided. We got 4 O&M trainings in progress, 2 completed, and that's it. And the last piece would be in June, I was able to finally connect with somebody in Northern Nevada that is interested in doing orientation mobility training. I've had some conversations with the individual. They do orientation mobility training for another, have a full-time job doing that. But there wouldn't be a conflict if they were able to do this. And so I have talked to this person. They're interested. There may be a few minor complications, but I'm really hopeful that we can get that secured so we can open that up in the Northern Nevada. Don, I see your hand up.
Thanks, John. I was just curious, do we have an estimate cost per person for the program that we've assisted with the O&M program, or even just a generalized cost per assessment?
So I don't have a breakdown of that. It's really not been my focus because we've still got resources left, but it breaks down to, I believe it's like $100 an hour to complete the assessment, depending on how complicated that is. And that's where they're really, they're defining what those orientation mobility goals are. And then the training is, I believe, also $100 an hour. I'll get those put together. Like I said, there's been 4 completed. There's total of 8 assessments completed. There was a couple people I know that they just kind of put things on hold, whether they were moving out of, I shouldn't say moving out. They were gone for, life happens. They decided to put things off. So I'm assuming that if we keep going, we'll have at least 4 complete. We got 4 in progress, 2 completed, and those 2 that are waiting in the wings there. So I do know I should have, just want to make sure I finish this thought. And I think it would be better to have Jean Payton from Blind Connect describe this. And I haven't talked to her in a while, but she had a sense of was a little bit concerned that, for all the time that they haven't had the resource and how many people have given up, moved, left, or they can't reach, that our data isn't really showing what we know. This resource has been missing for so long, right? How do we experience this in our piece of regular independent living. If somebody packs up and moves, or they change their phone number or anything, following up with somebody 4 or 5 years later may not be the chance. You may not have the best option there to do that. So that's one thing to always keep in mind. Go ahead, whoever's speaking.
Just to follow up, I was mostly curious because I was wondering, based on how much you have left and how long this could go on, is it only for the next, would you say the extension was 6 months or 3 months or something? I wasn't sure how this was going to be sustainable, or if it is, or if there's some way that, it could be managed. I was just curious.
In the end, I'm hoping we can just run until we are out of funding to do it. The portion that's going to Blind Connect is just covering that one person's part-time, like them making phone calls. And then after going through this backlog, I'm assuming, and again, it'd be better to have, make sure Jean, I'm saying this correctly, but going through all the people that they've been in contact with over the years, after getting through that, there's not really a big impact of people to engage with, right? It's not like you got this backlog of 50 people. So that's not a big expense. The training and mobility assessment is probably the biggest one. And I'm trying to look at.
But like you said, if it hasn't been something that has been available historically, and we don't know how that's affecting the numbers now, over the next year or 2, we could it would be a great opportunity to see how much growth there could be in that and how much it is needed, right?
Well, certainly. I mean, the thing about it is like so information referral to the centers, right? I mean, we could have centers go through and look up how many people have reached out to them saying, I need this. You may not have truly vetted information, right? But I mean, how many people are in your independent living network that maintain that call data? I would say we would have it clear back to 2017 for our portion of the program, but which I should also mention in my ATIL program update, we no longer have good call data. The transition to this other system it's just wrecked that. We do not have a method to look at and report that we're having people that are contacting us that are hitting, like we're sure that our outreach is working because we're getting consumers to call, the number of people that say they're interested, and so on and so forth. We don't have that. It's just the call system. And the good news is that an IT person with ADSD did say that they believe that they could build something for us to get back to that.
So,
Sorry,
so
I
do
was
you
going to forget.
Sorry, I keep following up with questions, but I was just wondering, does that mean that it is possible that because the SILC will be looking into obtaining a needs assessment, and yes, we will be using SIL data, but we were looking for all data possible, right? And would it be possible to grab that data from this program as well when we do that?
That was the intent from the beginning, to remind everybody how this went about. We didn't just, somebody didn't just come in and say, here's some funding. It was all up for discussion. And so there was, again, it was Raquel's initial conversations with some people, and it was getting morphed into a cane purchasing program, and they were going to chop it into a little grant and give it out to somebody. And fortunately, we were able to. Fortunately, there was a lot of people in the community that helped. Mark's on this call. Mark was one of the people I talked to multiple times. Raquel, a number of people with blind and severe visual impairments that have been in the state of Nevada for a lot of years. Everybody from their early childhood and how they went through the school. I had those conversations with everybody, and what I'd say what rose to the top obviously was that missing O&M training. So by doing that, we validated that hey, these funds are needed, that gap does exist, and we're going to collect information along the way. And it's available to anybody. It's just making sure we collect it all.
One last disjointed question from me.
There's no bad questions.
I was just curious, when we do the assessments, is any of this covered by any insurances? Is that something that some people might have, or is that even looked into as part of this program?
Well, I don't know. I doubt it. Or else people would be able to find an O&M specialist and have one done. I found some interesting stuff along the way, which I've got to compile. Everything from an organization back east that will coordinate providing orientation mobility specialist services. I don't know how that works. Maybe it's just a rumor out there in the wind, but I need to do some research on it. But I would like to just kind of read through you. These are some of the, I say they're screening questions. They're not. These were pieces to engage consumers about, and this is what we'd come up with Blind Connect. Asking number one, and these are supposed to be blended into conversations, not the proverbial ask you 90 questions to find out what you want or need. How are you as independent as you want to be? That's data we want to be able to get, right? That could be people that qualify for O&M at somewhere else, but are they as independent as they like to be? There would be a big question, right? If you were building a program, this is how the ATIL program was built. It was built through information and data that we knew gaps existed. If you acquired a disability or your aging, like just say one day you were no longer able to get into your bathroom because you needed a bigger mobility device, whatever it is, there's no resource for that. While we knew that resource didn't exist, it wasn't until we started getting independent living plans back 20 years ago and started building these independent living plans, and then we had we had people educating out there at that point that were saying, hey, these exist. This wait list is 3 years long, right? If you're in this situation and you can't get in your home, that's where it tied to the first Olmstead plan, right? That was coordinated through Office of Disability Services. Back then, our Olmstead plan pointed to specific services that were these options that kept people living there, not a generalized, we got 5 goals here. One of them is to increase the amount of employees we have. Anyway, don't get me started. Sorry, I'm getting off track. If not, what would enhance your independence? So are you as independent as you want to be? What would enhance your independence? Are you aware of local blind services, and which ones have you used? That was just, again, trying to figure out where they've been and what they've experienced already. Have you received any blind skills training? Hopefully, we're asking them to collect what they've received and where the training occurred. Have you ever had orientation mobility training? Are you interested in it? Describe why the person's interested. Are you currently working? Are you interested in working? Have you worked with Nevada Vocational Rehabilitation? Have you worked with VR in other states? If you're 55 or older, have you worked with Dieter's Blind Services for Independent Living? Was your vision a loss as a result of military service? I don't know what that VA thing is, but I do know some veterans that were their vision loss wasn't related to their service, but they were still able to go, but they had to go out of state for the training, right? I think it's still important information to know how many people are out there, right? Do you live alone? Do you have a support system? If they appear eligible, still ask the questions above, right? We want that was just a reinforcement back to we want a discussion on how they envision orientation mobility instruction will make them more independent, and then we ask them to go over what will take place if both they qualify and they want to go forward, and that's what I was describing to you, that O&M trainer is going to go and meet with them in their home. They're going to discuss what they're trying to accomplish, and then what the training would be coordinated directly with that person. Just one of the goals that came, some of the goals that came back, there was things on there that we weren't probably not going to be able to address. Like it wasn't actually a goal. It's like, I plan on getting a dog. It's not really an independent living goal, but what was important is the things that were on there, right? Crossing the street. I think there was one that somebody wanted to be able to eventually be able to go to the downtown area by the, like access the downtown area confidently. Those are the things that I think are going to be the goals. And we're not really writing down the one like, I'm going to get a dog, because
If you're talking Las Vegas, downtown area isn't accessible to anyone right now with all the construction.
oh yeah, okay. I was going to say the heat. And so we will have this information. Blind Connect's collecting it. I just haven't compiled it all, and we, like I said, I talked to Gene about going back and we want to get those 2 specific pieces of if the person, why aren't they accessing those other resources? And it'd be interesting to see. I have some. I've noticed this with our AT for IL program, and then our AT resource centers, right? So there's this piece in there that sometimes the path of least resistance. Somebody may not want to go to one program if I think I can get it easily here. And if that's what we want to find out there. Is there truly a barrier, or is there not?
Any questions for John? We gotta move on.
All right. If there's nothing else, I will shut up.
Thank you, John.
Thank you, everyone.
Okay. Sheila. you because
Absolutely. So I was able to grab a few details from the last two NSRC meetings that we had. So the last full council meeting was Tuesday, May 5th, 2026 at 1 o'clock. And at that meeting, it was a pretty good meeting where the council had a pretty robust discussion about a couple of things, including our annual elections for the chair and the vice chair of the NSRC. And so the chair continues to be Jack Mays. The vice chair is now going to be Sandra Sinecrope. She is a business and industry individual. And has served on the NSRC for a number of years. And so for the next year going forward, those will be our chair and vice chair. During that meeting, we also had a good discussion about starting subcommittees. And so the NSRC in the past did not really have a lot of subcommittees, unlike other statewide councils. And so moving forward, there was some discussion and action on creating a subcommittee to review the NSRC bylaws, which hadn't been done and revised since 2016. As well as establishing a subcommittee for employment engagement and various initiatives. So for the volunteers and the subcommittee for bylaws, Jack is our chair for that one. And we had another, our first subcommittee meeting here that I'll give a little bit of an update on as well. And our employment engagement initiative subcommittee, that one hasn't quite met yet, but the whole point behind that one is to start talking more robustly about services to employers or businesses that hire individuals with disabilities and some of the different programs that can be done to increase those efforts. So those two things happened. So we established some subcommittees. We also did our annual elections. We then had Cindy Sendagorta, who is a parent advocate in the North who has since relocated here to Southern Nevada. She is our new chief over the Office of Disability Employment Policy. And so with her onboarding to the VR program, she has reimagined that side of the house and services to businesses. And so she talked with the council about some initiatives and things that she hopes to bring forward under her tenure here as the ODEP chief. Then we talked a little bit about our membership updates. We have been working hard to fill the 16 required NSRC council seats. We've had probably 4 individuals named and appointed through the governor's office in the last 6 months. And so right now it looks like we're still down maybe 1 or 2 seats. And of particular note is the 1 seat that is the tribal VR or the 121 program seat on the council. And so we'll continue to do some recruitment and looking out in the community for someone to fill that seat. Outside of that, our administrator gave a bit of an update on the state's combined WIOA state plan. So similar to the SILC that has the spill, the NSRC and the state workforce development system has a plan that identifies initiatives, goals, priorities for the state workforce development system as a whole. And as a representative in that system under Title IV, Voc Rehab, we have a pretty substantial part of that. And so Drazen gave a bit of an update on the revisions to the state plan and the modifications. And from what I understand, public comment has closed for that, and we should be seeing those that state plan posted here very soon, if not already. Dawn, you have a question?
Yeah, thank you. And I really appreciate you filling us all in and the information that I missed. But I did go through the materials and I was looking at some of the materials from the WIOA state plan, and I didn't see anything necessarily specifically about how the innovation and expansion funding is going to be allocated, but is that where it would specify if there was going to be any allocated for SILC, or is that's what I thought. I didn't see that in there. Was that part of it?
Yes, it is. And I will follow back up with you and put it in the chat where specifically it is. It's a specific item. And so I can find that and put it in the chat for you.
Thank you so much. I appreciate it.
Absolutely. Other than that, we had our normal updates. And so that is that meeting. And then we had on June 9th at 1 p.m. our first subcommittee meeting for the review of the bylaws. And that I think went really well. Jack, who is the chair of that committee, reviewed, and we made a bunch of possible revisions to the bylaws. Of specific note, and something that has come up for us pretty frequently is our difficulty in being able to recruit very challenging seats on the council, and having individuals available to be able to apply for and be appointed to some of them, with the lack of clarity around the number of terms that individuals can fill, and if individuals are appointed, can they be consecutive terms, etc. Right? You all realize this, that our disability community can be a small community, and so a lot of the individuals are doing double and triple duty, and we don't want to unnecessarily restrict ourselves in being able to have good professionals and advocates and representatives of the community on the council, just because of term limits. And so that was one of the primary focuses of why we wanted to establish the subcommittee to review the bylaws and make those changes if necessary to allow us to be a more effective council. And so those revisions are pending. I don't believe we have another meeting scheduled at this time. We may. But those are the two meetings. Our next full council meeting is scheduled for September 1st at 1. We do host these meetings both virtually and physically at our district office in Reno, as well as here in Las Vegas. And if you all need that information, or once the agenda is posted for the public, I'll send that to Dawn, and she can circulate that to the SILC as well. Dawn?
Thanks again, Sheena. I really appreciate you sharing all that information with the council. I want to express how excited I am to hear about is it Cindy, who's the new person over. Yeah, I'm super excited to hear about the new initiatives there. I can't wait to the next NSRC meeting to hear about it more. Thanks.
Yes, we are super excited as well. She's bringing a bunch of new, fresh ideas to the agency, and we're super excited. One thing that she has brought to us, and we're doing a survey across VR participants on, is a possible transportation barrier kind of survey from a counselor perspective. I'm sure we will be surveying current VR clients for transportation related barriers and needs as well going forward, but I'm really excited about what this kind of work might be able to help us develop in terms of really addressing some things in the community at large that continue to be really big issues.
So I also recently heard that Waymo is now fully automated in Las Vegas, and that they're transporting employees. Is that part of something that VR is looking at, or do you know?
I'm not certain. I know that we have talked about some things internally about things we can do for our rural communities where the challenges might be a bit more prevalent. Um, so yeah, that's about all I can say on that. Any other questions for me? And if it pleases the council, Dawn, I'm happy to do these quarterly updates on behalf of the NSRC, or if you wanted to do them, that's fine. But since I have to attend them as a employee of VR, I'm happy to provide the report out. So you just let me know.
Sheena, I always try to make it, and when I do, I try to give the best update I can, but I always appreciate it if you want to tag team and, kind of hit stuff that I might miss, I would appreciate that greatly.
Sure. Looks like Dee Dee might have a question.
Yeah. Dee?
Hi, Sheena. I work on several transportation boards in the rural communities. And also, I know Margaret does also. And so we would really like to be able to touch base with you, if that's possible. So I'm better doing things auditorily. So if you could give us a call. So my number is 775-450-3729. Huh?
Did I catch 450-3729?
Yeah,
Okay,
that's 775.
you got it.
And that's my personal cell. So if you'll give me a call, I'd really like to discuss this further with me and Margaret available. So anyway, thank you very much for your presentation, and hopefully we can be helpful to you.
Absolutely. And Margaret, if you're able to put your contact information in the chat, I can reach out and we can try to schedule some things. Once currently the transportation initiative, kind of that survey, the client needs survey is happening right now in the program. And so it might make sense for us to have a conversation once I get some survey results.
I will
But
do that. This is Margaret Markich. I will put that in the chat for you, dear.
thank you.
Also, I was going to say, we might like to participate in that survey too. So you might put a link in the chat and that would help us.
Did you say the survey is currently with counselors at this time, but you're
It
hoping?
is.
Okay.
It is.
It's only with counselors.
Yes, it's currently
Okay.
we're doing it on a kind of a scaffolding kind of level, right? So we're starting with counseling staff to identify from counselors' perspectives, transportation barriers. And likely then the next rung will be a VR client survey on transportation barriers. But what I'm hearing is a desire to participate as a community partner and being able to provide community feedback also as part of that. And I can certainly share that with Cindy and we can figure out if we can extend that to the community at large and how we might be able to do that.
Yeah, because we would definitely like to work as a community partner with you.
Mark Tatter, I have a question or a comment.
So we have offices in Carson, Lyon, Douglas, Story, and the Elko area.
This is Mark. Can you
So
guys hear me?
anything we can do to help, let me know.
Why is this thing working?
We can hear you, Mark.
Yeah.
Okay, sorry. Yeah, we at Northern Nevada Center, we have a very large newsletter that we can send out statewide, except for Clark County. We're working currently with RTC Washoe, and we've worked with some of the other agencies. Transportation's a huge barrier. We had a gentleman yesterday who was in here because he lost his job because he couldn't drive. He was in a car accident. He has a substantial disability, and so I mean that's an ongoing issue, of course, particularly in the rural areas, but not necessarily parts of Washoe County include that, have that issue as well. But, you know, I started a transportation coalition before I was working here. So I have a lot of influence on this, including a long career with Enterprise Rent-A-Car. I know the rules very well. And we can circulate any survey or provide any information that can help with your service.
Absolutely. Thank you for that, Mark. And so I will definitely talk with Cindy, and we can strategize on how we can extend the survey. And once we get to that point, I'm happy to share it with all three SILs, and the state, so that we can get as much feedback as possible.
Thank you. Yeah, there's huge need. And we've got plenty
Absolutely.
of data for you.
Absolutely.
Thank you, Sheena. I think I'm gonna take a 10-minute break. I'll be back at 2:16. Welcome back, everyone. Now we're on hideaway. So have updates from ADSG.
I think I'm going to take this item for today, since Lori's
We
gone.
can't hear you.
You just sound really far away, Autumn.
Is that better? If I move it closer? No.
I can't.
Hold on 1 second. I'm going to join on my phone. How is that? Is that better? Okay, perfect.
Thank
Let
you.
me just pull up my note. No worries. Thanks for catching that, Julie. Alrighty, so just a couple of updates, nothing too crazy, but I'm happy to answer any questions that you guys may have today. I apologize if I sniffle a lot. I have a little bit of a cold. So the only updates that I have is there were some subawards that recently went out. There was a couple of grant opportunities that were going through the competitive process recently. And so all of those grants have since closed, and those subawards have gone out to community partners who have applied and been awarded. The other update that we had was it's not a new program, but it's kind of being revamped, is the Money Follows the Person program. And this is a program that supports individuals transitioning out of facilities back into the community. And so we have a statewide partner, which is Access to Healthcare Network. And I know Jamie, who is our planning chief, had mentioned she invited Dawn and some of the SILs to engage in stakeholder meetings to really kind of help shape the program and help individuals with transitioning from facility to home. And we will be finalizing a flyer soon, so we'll be happy to send that out once it's finalized. The only other update that I had was there was a grant opportunity that just came out today for opening minds through art. And that is an evidence-based intergenerational art program for people living with dementia. And so that opportunity came out. If you're interested, it should be on our website as well as Nevada ePro. And I apologize, I have one more update. One thing that I am personally working on is a personal care services project. And so we have some ARPA funds that helped us redo establish training that is consensus-based curriculum that is regulation compliant for personal care attendants. And so that will be launching soon. And with that, we'll be having some incentives for people to complete the training who are current direct care workers who are working in personal care services, as well as those who are maybe interested in pursuing that career. And so that incentive is available for those who are currently personal care attendants, as well as those who would like to be and would like to take the training. We're still hammering out the details, but more to come on that, and I'll be sure to send that out to Dawn to share with the group when that comes live. We are also having a direct care workforce campaign coming out soon here, and my hope with that is to really re-professionalize direct care workers. As we know, these professions oftentimes they're pretty low paid, but they do amazing work and are really essential to our home and community-based services network. And so the hope with this awareness campaign is not necessarily to recruit new direct care workers, but to really help the public understand the importance of these workforce professionals, as well as socialize the term direct care worker in our state. I've been working with the National Direct Care Workforce Strategy Center, which is part of the National Council on Aging, over the last couple of years through technical assistance with them. And so we have some really great subject matter experts that are helping us lead that. Part of the campaign, though, and the reason I'm bringing it up to you, is that we will be sending out an opportunity for individuals either who are personal care attendants or any other type of direct care workers, so home health aides, nursing assistants, kind of in that direct service category, and as well as family members and individuals with disabilities and older adults who would like to be part of the campaign and express their experience with direct care workforce and how personal care services maybe have touched their lives. And so there will be a financial incentive for that. And so once that information is finalized, again, I will send that out to the group. Happy to answer any questions. And I apologize, they're not super in-depth updates, but here if you guys have any questions.
Julie, this is Mary Volsizer. I have a question, but my hand to raise my hand is not working.
We lost you. Mary, we can't hear you.
Oh, you can't hear me?
Okay, now we can.
Okay, how about now?
Yeah.
All right, thank you. Hi, I was asking for special permission, Julie, I can't raise my hand, but to ask a question.
Yes.
Thank you. Autumn, thank you. That was really good information. I just have a couple of, one comment and then a question. Like mind things alike, I wanted to let our council know and you as well, Autumn, that last week we've been working with Money Follows the Person, and when they were in existence last time, we worked with them and we found the best way to work with them is to have an introduction of all of our team members in one group
Mm.
define our roles, and then define our services and identify which are the best services we can partner in. So we're excited that Money Follows the Person is here. And we've started working, we're establishing our referral process so that we can work together in a smooth and cohesive and of course efficient way. Then the other question I had, you mentioned that there were a couple of grants that were sub-granted. Do you know what types of programs were sub-granted? I don't
That
mean
was
to
a
put you
great
on the
question.
spot.
No, I appreciate that, Mary. Autumn Blackman for the record. I don't know the specifics. I got that update, just kind of a general update, but I'm happy to provide that to you guys if that's of interest to the group.
All right, thank you very much. And then Mark Lee he's the coordinator for the North. He's going to reach out to you to set up a Zoom similar to what we did down here. But we're happy to meet together as a whole group. We've always found that if the team members know each other and there are grassroots folks out there that, again, we're trying to get to know all of them. We're going to have another meeting later because we also identified a lot of voids and gaps in services that both of our programs are having challenges. Thank you. Thank you, Julie.
Please,
Hi, this is Ace Patrick for the record. I have a question, Autumn, right? Uh, so I am a client with ADSD and I receive home-based community services. I have a personal care attendant through an agency here in Washoe County. Are those the folks that you'll be working with training? The PCAs that are with different, I mean, there's so many different agencies here where we've had to try to figure out who to connect with for a PCA that works well in the home with us as individuals. So are the people that you're going to offer the trainings to and also invite to be a part of this larger group to give input as to and um is that what's happening?
Yeah, yeah, thanks,
I wanna-
Ace. Yeah, this is Autumn for the record. So the training that we have is actually a completely online training. So we'll be having this information go out to all the agencies across the state that are enrolled as licensed providers with HCQC. So yes, any of the home and community-based waiver agencies that are providing personal care services, they will receive the information to have their staff go through the training. There will be a financial incentive. It will be first come, first serve, of course, because we only have a certain amount of money for those who take the training, as well as the providers who incentivize their staff to take the training. And then as far as the other piece of the campaign, where we're looking for input, really what we're looking for is individuals who would be okay with us filming them on their impact and their stories relative to direct care workforce, whether that be somebody who is receiving services, somebody providing services, or a family member who has seen that impact directly. So does that answer your question, Ace?
Yeah, Ace, no, this is Ace Patrick again for the record. No, yeah, that's wonderful. Thank you very much. That's exciting to hear. And when my PCA comes back, I'll so are you already rolling out the training program or not quite?
Yeah, this is Autumn for the record. So it's still in review right now. It should be coming out fairly soon, but I'll make sure that when it does come out, that I'll send you guys some information so you're notified.
Oh, that'd be great. My PCA and I might be interested in the other component too with the filming stuff.
Great.
Yeah, so that's fantastic. Thank you so much. I'm so glad that this is happening. It's about time.
Me too. Yeah, I'm really excited about this project and to see it come into fruition. So I appreciate that feedback.
Margaret,
Hi, this is Margaret Marcucci for the record. I actually have had all the training to be a PCA and to work with people with dementia and Alzheimer's, as Dawn knows. And I'm glad that you guys are doing this because I'm in Elko, Nevada, and I think we lost our person for doing stuff. I think we lost our oh God, yeah, uh-huh. I'm okay. Don't mind me. I'm rattled right this minute in time. Um, Something else came wandering through my life. Uh, it wasn't good. But anyway, yeah. So I'm interested. I don't think that they have any. They do have 4 agencies here in Elko, and I will share the information with. I have a lady who I know she would love to do an interview. I was thinking about that, and believe it or not, her name is Margaret. It's not me. It's one that I've worked with, and I've gone over and done a lot of PCA things with her. So thank you, thank you. That is awesome because I work here in the rural community and I work with CareSource and Silver Summit and all of them know me. So thank you.
This is Autumn for the record. Thanks, Margaret. That would be fantastic if you would share that. I really want to make sure that we're touching the rural areas, and hopefully you'll see the campaign come in the rural areas too, because we're trying to target specifically the rural communities because we know there's a huge lack of direct care workforce in that area. I mean, across the state and across the country, but specifically in the rural and frontier areas of our state.
Would you take emails from Dawn and send us the information so I can share it with people here? I'd be more than happy to.
Yeah, this is Autumn for the record. Margaret, I think I actually have your email, so I'd be happy to send
Yeah,
something
I
directly
think you
to
probably do.
Yeah, perfect.
Margaret, really, for the record, I have a quick question. Are these training that the independent living philosophy influence these trainings? And how
Can you say that one more time for me, Julie? I apologize.
did you get that?
I think so. You said that stop me if I'm wrong, Julie. I think she said you said that the trainings were independent living philosophy oriented, and I think she's wondering where that came from. Is that correct, Julie?
Or how, like, where did you use that perspective in the training?
Yeah, how did you use that perspective in the trainings?
That's a great question, Julie. This is Autumn for the record. So we actually, I did not create the training, so we have a contracted provider, Public Health Supportive Services, that is taking on development of the training. And so part of the review process that I'm currently going through right now is to take a look at making sure that it's person-centered as well as independent living focused. But the main thing that we were trying to get through the big hurdles of is getting our training through HCQC. So we took some existing trainings, we took statute, and we took requirements that are nationally recognized for direct care workforce through that strategy center that I mentioned, and kind of cross-examined all of the requirements and kind of best practices, and then built our foundation of personal care training from there. And then we went through the review process with provider agencies and direct care workforce agencies, and then through the HCQC process.
Thank you. I've had a lot of issues with that. With my own PCAs. But
Yeah, thanks. This is Dawn Lyons. I just wanted to mention, just to remind Aging and Disability Services that the SILC, we are experts on independent living. So we are here as a resource for that in all of the, regarding all of the programs
Yeah.
that you have. So never feel afraid to reach out to us and, present these things to us. We can always provide some information that would be helpful.
Yeah, and this is Autumn for the record. I would be happy to share the curriculum if anybody would love to go through that and give feedback. That would be great. Right now what we're doing is I'm reviewing it just for quality and making sure that it sounds good from my perspective, but really this is kind of like a beta testing time. We have time to tweak the training and make some edits. If there's things that are like blaring red flags, which I really hope not, but if there's anything that you guys have questions on or feedback on, I would be happy to take that.
Well, and I'm sorry, Julie.
If there's many of us who would like to take a look.
Yeah, I was going to say,
Sure.
if you want to email that to me, I can share it with the whole group and we can put it on the agenda or just give you the update during your updates at the next meeting too.
Yeah.
Yeah, let me talk to, sorry, this is Autumn for the record. Let me talk to our agency that is overseeing the training, because right now it's kind of hidden. It's on the back end of our LMS, but what we did with the provider agencies is we just sent them kind of like the slide deck for review that way. And so maybe I can talk to you, Dawn, about what the best way to share it with the group would be. I would absolutely love feedback.
Thank you. Page 2. Okay. Thank you to Autumn rather. Okay. We're gonna move on to G. Any conference reports?
Thanks, Julie. This is Dawn Lyons, talking about updates and discussion regarding takeaways from conferences attended by members and information regarding upcoming events and conferences. The first thing I'd like to mention is that when I was giving my Youth Action Council update, the first thing I started to say that I accidentally blanked out on was that one of our new Youth Action Council members, Leah, and myself, we presented at the Crave camp for that's a vocational rehabilitation camp. They invited us to present on the statewide independent living council and the youth action council, what we're about, what we're doing, and how we're recruiting for the youth action council to the youth at that camp. And we spent quite a bit of time and had a formal presentation with slides and everything, and the youth were fantastic, and it was a really amazing way to connect with the youth. And I was so impressed by the Crave counselors and what they were doing there. And it's just, I was super impressed by the Crave camp. Glad we could be a part of it. I was really grateful. The other thing I was going to mention is that I also presented to a PREATS camp that, what are they called? It's the organization through, I know their home base is at Opportunity Village, but trying to think of the organizational name. I'm drawing a blank. Anyway, they were hosting the camp over at the Clark County building, and I went ahead and presented to that youth group there. I don't know why I can't think of the name right now, but anyway, it was for PREATS. So it was also another good opportunity for SILC to share about the Youth Action Council and what we're doing. And it looked like we might have a couple youth that might be interested from that presentation as well. So regarding the conferences, there haven't been any recently, but we are planning, we do have some coming up really soon. And the first one is the TRIP conference. And that's like I was talking about, that's for the educators. And Calvin and I are going to be presenting there, and as well as we'll be presenting with the Centers for Independent Living, because we thought it would be a better idea just to present about independent living and the philosophy and what that means together, so that we don't confuse anyone, make anyone think, oh, well, what's the difference between, SILC and YAC and the Centers for Independent Living. So we put it all together and we're all presenting together, and it seems like it's coming along good. We've been rehearsing and it's coming up fast on July 31st. We're looking forward to that. And I always forget, so this time I brought it up, what TRIP stands for. It's the Nevada Transitions Roadmap Through Innovative Partnerships. That's what TRIP stands for. So don't ask me again. No, I'm just kidding. Anyway, it's a really exciting opportunity to be able to present to the educators, because hopefully we'll get some people reaching out to us from those local education agencies in the future, so that we can do future training on independent living and the independent living philosophy to the students with the instructors, and get into a little bit more into the rural areas of Nevada and places that aren't receiving those messages now as easily or as readily available to them as the urban areas are. So excited about that. And then also the Silver State Self-Advocacy Conference that the Governor's Council on Developmental Disabilities hosts. We are going to be presenting 2 workshops there. I think I mentioned it yesterday. The first day is going to be the Youth Action Council is going to present at the end of the day I think it's the last workshop of the day, at 2:45. The same presentation that they did at the April conference, and our Jax is going to be filming that. And then on the next day, on August 4th, at the same time, but is a general session now instead of just a breakout workshop. The DD Council actually wanted it to be for everybody, so I'm super excited about that. Our colleague from Idaho, Mel Leviton, is going to be coming out and talking about the independent living philosophy, and we're going to be filming that as well. So lots of exciting things coming up. The National Council on Independent Living is towards the end of July, and I will be attending that. I know, Mark, you had mentioned yesterday you didn't know who else was attending. I'll see you there. I don't know. I didn't get any other SILC members that were able to make it to this one, but hopefully maybe next year. And I believe that we're working with you and Mary on a potential scholarship for youth to attend as well. Oh, Autumn says she'll be there as well. Thanks, Autumn. So yeah, so we'll all be at the Nickel conference, and that should be a good one this year. Interesting with all the federal things going on, huh? But then also the April conference is approaching faster than I'd like. I mean, time has been just flipping by. April is always in October, which always confuses people, but it's the Association of Rural Programs for Independent Living is what April stands for. And I know, Dee Dee, you had mentioned that you're interested in going. I think you won a registration already, so you already have that taken care of. So it's in Niagara Falls. Sorry, the self-advocacy conference. Oh, okay. Autumn said she's going to self-advocacy conference, not Nickel. Okay, gotcha, Autumn. Thanks. I'll see you there. Anyway, Dee Dee said she would like to go to April. If there's anyone else who's interested in going to the April conference it's going to be in Niagara Falls in October, please let me know. Sounds like it might be a little chilly up there in October, but who knows? But yeah, just reach out to me and let me know, and we can get you scheduled for that pretty soon. I'm sure SILC Congress is going to be on the board again. They haven't made any announcements, but they're usually in March, and I don't know where it's going to be located this time yet, but I'll keep you informed about that. And I'd really like to see a couple more of you go to at least SILC Congress this year, because they always have an extra session for new members and people who need independent living training and what, kind of like the basics of what SILC's relationship is with the network and all that stuff. And it's really good information for, especially for new members. So if you're interested in going to SILC Congress, it's not too early to reach out to me about that either, and we can talk about it. Anyway, I think that's all I have right now on conferences. But I can move right into the trip program because I pretty much already talked about what we're doing there. We do have a new they did put out a new postcard. I can send that out to everybody who's interested. Just let me know if you want a copy of that postcard so you can display it wherever you're at, or so you can, share that information. Trying to think if there's anything else about that. I think it's pretty much the same information that I told you at the last meeting for SILC when I gave that update. We're just getting ramped up for the trip conference, that's all. And yeah, and we've got a little bit of a budget for travel, and I've got some supplies for future education for trip with the Youth Action Council or without the Youth Action Council, for both. If we get invited by local education agencies, I know ELCO has already invited us, but we have yet to set a date for that. So we already have a training planned for independent living for ELCO. So tentatively anyway. And that's what I've got for trip. So I think that's it, unless anyone has any questions.
Could you go into item 8, please? Good.
Sorry.
Could you speak that? Item 8.
Oh, item 8. Oh,
Yeah.
yeah. So, okay. So item 8 is the fiscal year 27 review and subawards for needs assessment request proposals. I did include the materials. I posted them, I believe, Monday. Or no, I posted them over the weekend. But anyway, they were the only, Black Swan was the only one to submit an application. However, I did read through it. I hope some of you at least got to read through it. I would like to recommend that we go ahead with their proposal, since first of all, it is the only one we did receive, and second, it looked pretty solid to me. They did not include travel because I did have a discussion with her. Her company was concerned, or her corporation was concerned about the budget based on what they were looking at, and it looks like we do have a little bit of a travel budget within our third-party fiscal agent account. And so I mentioned that I would be willing to assist with outreach, and that we could maybe assist with some travel through our private funding. But other than that, the proposal itself and how they plan to execute the needs assessment, it looks pretty solid. They're talking about everything that we were thinking of and that we mentioned. I'm not sure who else they talked to, if they talked to the Centers for Independent Living at all or whatever, but it seemed to include what the centers were asking for. And it looks good to me. So if you guys would like to either have a discussion about that or even just provide a motion to approve their proposal, I would open to either.
Let's get a motion and then we can have discussion.
This is Patrick. I move that we accept the proposal for this subaward. I looked it over as well, and it looks really good. And I was hoping that the to center, the three centers or the two centers that they'll, I don't know if they're working with the rural center as well, but I know they specifically mentioned Northern Nevada Center, for independent living, in this. So I was hoping they looked it over as well and thought it was pretty solid. So I'm in agreement with you. So I'd like to move that we move forward with this and accept their proposal for and grant this sub-award. Is that is that too wordy?
Yeah, yeah. Is there a second? Is there a second?
We,
You didn't even have time to look at it.
yeah, I'm wondering if people didn't have enough time to look at it, or if there is a second so we could discuss it.
Yeah, I did this, Mark. I did not have a chance to read it.
Did anyone besides Ace have a chance to look it over? Julie, you did?
Yeah.
Are you able to second it? I don't see why not. You're a voting member.
Okay, I'll second.
Okay, so I guess we're open for discussion now. Did you guys have any, Julie, did you have any thoughts about it that you'd like to share that maybe, I'm not sure if we'll get a full vote on this. I think we're gonna get a lot of abstentions um, if we don't have a lot of people that read it or that understand what's in it. I can maybe possibly pull it up and share and
Yeah,
some of it.
we do that.
Yeah, this is Ace Patrick. It was quite it's lengthy, but it's quite extensive and very thorough. So
Yeah,
I mean I had to listen to it twice because there was so much in there, but it's well worth people taking a look at. But yeah, I think Don, that would be helpful.
Okay.
I thought it's very professionally presented.
I'm just making it big and then I'm going to share my screen and I'll start reading it when I share my screen here. Okay. So I'm going to scroll through the aging and disability services mumbo jumbo at the beginning, just because it doesn't have anything to do with their proposal. Okay. So they discuss the understanding the challenge and service gaps. They talk about the two centers for independent living divide the state geographically. They go through all the different counties and they give some stats on that. And then they talk about what their assessment will produce, and which is a county level consumer informed evidence identifying where services exist, where gaps remain, and what strategies would improve equitable access. Crucially, it will provide an evaluated answer on whether a formal resource sharing a memorandum of understanding or MOU between Nevada's CILs is operationally feasible, directly informing Nevada SILC's resource allocation and the 2028 through 2030 state plan for independent living. They talk about under project goals, objectives, and deliverables, designing a strategic assessment framework, conducting accessible, meaningful statewide engagement, delivering actionable findings via the MOU feasibility framework, And it says at the bottom, measurable outcomes include documented consumer engagement in all 17 Nevada counties with at least 25% of direct engagement participants representing rural, frontier, and tribal communities, and a completed MOU feasibility determination within the performance period. The deliverables will include a detailed project work plan and timeline, accessible data collection instruments, stakeholder engagement activities, county level analysis, draft and final assessment reports, an executive summary, a presentation of findings, and practical recommendations that support the implementation of the 2028 through 2030 spill. They go through quality assurance and the anticipated challenges and mitigation strategies regarding frontier geography and inconsistent broadband, survey fatigue, community trust. They talk about organizational capability and project sustainability. You know, who will be involved in the project and who will be working with on it at their organization. And then reaching Nevada's underserved populations and strategic partnerships. And then they have a table which includes a work plan where it lists the objectives, the strategies, and the timeline and evaluation of it. And so there are several, let me see how many there are in total. 3, 1, 2, 3. There's 10 total. 3 of them being in the category of outreach, three of them being in the category of service delivery, and 4 of them being in the other category, which is I think regarding the report. Yeah. So basically, let me go back here. Sorry if I'm making you dizzy. Not trying to. So they want to launch a coordinated outreach. They want to ensure meaningful participation of consumers and reach consumers in the rural, frontier, and tribal communities. And they list all of the ways that they plan to do that, which I think is pretty thorough. And then under the service delivery, they're going to finalize a study work plan and accessible data collection instruments, and they'll have it approved by the SILC before they use it. They're going to collect mixed method study data across Nevada counties using surveys, focus groups, key partner interviews, and review of existing reports and demographic data, which also will include the SIL suite data that the centers have. And, you know, how I said that, AT for IL, if they could provide their information, and anywhere basically that includes independent living, they can pull that data from. And then they're going to produce a comprehensive written regional consumer study report with clear findings and MOU feasibility recommendations to us by June 2027, which I think is an awesome timeline. So yeah, that's pretty much the gist of it. I'll go ahead and stop sharing so I can see if you have any questions, or if you think that's enough information that we can go ahead and take a vote on, or if you would like to ask more specifics. Mary?
Dawn, thank you. And then Julie, thank you for letting me speak. To be honest, Dawn, I didn't get a chance to review that as thoroughly as I would like to. And then just looking at the data that they're going to be collecting, that the data collection process is, I think it's really needed. I thought our goal was try to identify, because both CILs in Nevada have stated that we're both underfunded to actually, we don't feel we have the funds to serve the counties that we have right now. I know in Clark County, we could duplicate our team members 2 or 3 times and we still wouldn't have enough. And Mark, I know with the 16 counties, you're in that same situation. Maybe if you could clarify, but the data is geared towards, in the end, developing a memo of understanding between the CILs. And I think if you
No.
could clarify that.
Yeah, no, that's not the main goal. That's also just one of the outcomes that they're going to provide us with. The main goal or the main outcome they're going to provide us with is the needs assessment piece of it, or the aspect of it. So where their needs are, where there's gaps, why that, what kind of, what that includes or involves, and what that means, right? And so that's what you're talking about as far as, we'll have some real actual data that we can show that would inspire more funding to come into independent living, so to speak, right? So we would have
Right.
actual data to present.
Okay, now that part I see and that part I understand. And I think the groups are an awesome idea. Can you clarify for me, please? I'm just not able to wrap my head around it. But what is the memo of understanding? Because with the way the centers work right now, we have 2 centers in Nevada, and our funding source is the Administration for Community Living, and we are very thankful and appreciative that they're able to fund us. We understand that though it's not enough to serve the populations that we really need to serve, but the data will show us that. So with the 2 centers, I guess the territories or the counties are already divided. So where would the memo of understanding come in?
Are you asking Mark or are you asking me?
Oh,
Because,
Don, if you could explain it
okay,
to me,
yeah.
please.
So,
Thank you.
yeah, so they're not saying that it would, or that there even would be an MOU necessary. What they're saying is they would analyze the need for one and include that in the report. If there is a need for one, they would make a recommendation. That's all.
A need for a memo of understanding, it says, between the CILs.
Yeah. Or,
Okay.
yeah.
So that would be a memo of understanding between Northern Nevada Center for Independent Living and the Southern Nevada Center for Independent Living.
Yeah, that's what they said.
Huh, because
I think they're just analyzing any need for a memo of understanding for independent living services in general. But they're
Okay.
talking about an MOU with the 2 CILs, one of the 2 CILs, one of the two, right? So they're not saying that one is needed. They're saying that after doing the needs assessment, they would be able to evaluate that and make a recommendation if necessary. And that's what we
Okay.
were asking for.
Yeah,
That
and
was
we're
part of-
asking for the data.
We were asking for the data, and we were asking if they saw a need for an MOU. So it wasn't just, yes, we were asking for the data, primary first and foremost, and that's what we're getting with
Okay.
this needs assessment.
So
But
does that
also,
mean, oh, go ahead, please, Donna.
but
I'm loving
also,
what you're saying.
if there's a gap that's being filled elsewhere, is there a need for an MOU with a Center for Independent Living to fulfill that need? That's what they're going to say. And that's the other part of it.
So that would mean like if, I'm trying to think because, let's see, if there's a need for an MOU with the center and another organization.
Or between centers. It doesn't
Okay.
really specify who with, just with the centers,
Okay.
if that makes sense.
Okay. That, I love the data part. That part I like, and gathering the data, and that's gonna be such a wonderful boost for us. The MOU, I'm not clear on, only because we've operated and in Nevada since 1984, based on the north does the 16 counties and the south does Clark County. And just so you know, we both get almost the exact same funding, which is not enough to cover either Clark County or the rest of the 16 counties. So if a memo of understanding came about, let's say, if there's a need for a memo of understanding for someone else to provide Center for Independent Living Services to help maybe me or Clark
Or
County,
Or
Mark?
maybe just a memo of understanding if someone else is assisting in filling that need, and it could be done through a center, that maybe the center can create an MOU or that kind of thing. It's not saying that one is needed. It's not even saying what it would be needed for. It's just saying that they would provide a recommendation if they saw the need for one. And that's after they do the needs assessment. So we're really getting what we want. And we don't
Right.
even know if they would find any need for an MOU.
Okay. I guess I'm confused about the MOU. How about
Again,
you, Mark? Did you get a chance to read it?
I have not, but from hearing this discussion, I mean, the understanding was the data collection was to determine the funding levels that are needed in this state. The MOU and that whole bit with having another outside party coming in, I don't remember that being part of our discussion. And I'm not really in favor of that, but I am also maybe not understanding this completely. So,
Well, if I remember correctly, and I don't remember the details, but I think the MOU was actually suggested by ACL. Am I correct? I don't remember the details, but from my recollection, that's where the whole thing started, with ACL.
yep.
Can you speak more to that? Because it's been a while, and I don't remember the details.
Sure, Julie. This is Dawn Lyons. Yes, you're right. Erica from ACL had originally said that that is what we need to know if an MOU needs to be in place, and that part of an outcome of a needs assessment could assess that aspect. That was her suggestion. And at the time, that was what the SILC had agreed to. So that's what one of the things that we had asked for in our RFP. Go ahead, Mary.
Okay, thank you. Yes, okay. The conversation's coming back to me now, because I checked with Erica on this as well. And there was, I believe, at one point, some verbiage that recommended an MOU between the CILs and perhaps another CIL that was not Part C funded to engage in a memo of understanding. However, what we were able to find out, and I remember researching this and meeting with Erica, we asked about that. And then, and Erica, for those of you that don't know, she is our, with the Administration for Community Living, that's our funding source. She's the bureau chief. And that's usually who we go to ask questions. She said that a memo of understanding between organizations in that capacity would come about only if the centers had met and the centers were willing to enter into a memo of understanding. And that what led us to think is that we don't know, we feel we're working at capacity with the funding that we have. And what we had hoped for support from the SILC was to have a needs assessment done where we could identify, maybe we're wrong, maybe we're just, not processing our services correctly. Perhaps if we made some changes, but maybe the population is there for more, but we can't ask for the funds until we show what the populations are there. That was our main intent. And then the topic of the memo of understanding came about, if I'm not mistaken, if there was another similar service, similar to a Center for Independent Living, then a memo of understanding would happen if the two CILs met because it has to be approved by all CILs in the state, and then the determination would have to be made by the CIL that was entering into the memo of understanding. So I don't recall that the centers were so much interested in a memo of understanding. Not that we couldn't use that. I'm sure, you know, that there's always alternatives. However, our intent was to get data for the state of Nevada so that we could more confidently speak to, we have this population here in this county, we have this service, you know, this is what we're doing. Do we have enough funds to do what we're supposed to be doing?
Yes.
Or should we be asking for more?
So yes, Mary, this is Dawn Lyons. You are absolutely right. That is exactly how the conversation went. And this is why it was included in this assessment, is because with the funding provided for the assessment, it's like we're getting an added benefit of having a recommendation on top of it. We're already getting the needs assessment done with the funding, with very little funding we had, which is the $30,000 that we were going to put into it.
And we appreciate that.
And then of course, after we get the recommendations, the centers would get together and decide on their own if they wanted the MOU to go through or not. That is not up to the SILC. It's just a recommendation as far as what the needs assessment comes to. That's all.
Okay, I'm sorry. The needs assessment with the data that, and I was looking and I did review briefly the workshops and the information and the data gathering. That part looks good. And then I think I was just thrown by the memo of understanding, because I know we went into great detail and at length, and I know, Don, you talked to Erica, I talked to Erica, and I think we all learned what the meaning of a memo of understanding is. So, Mark, though, you haven't had a chance to read it.
No.
And parts of it do involve, and then we are more than happy to do our part, Dawn, in helping to gather data, helping with focus groups, and involving our consumers that we have now. And then our hope, though, is to reach individuals that don't know. Those are the underserved, the ones that don't know about us. So anyway, that's kind of where we stand. And Dawn, I can't express to you how wonderful it is that I believe that you got an RFP out and then got a bid on it. That's a hard thing to do. It's not easy, and I know
Sure
how
is.
hard it is to get companies to even bid on what the types of funding that we have. So anyway, that's my 2 cents worth. The MOU threw me, Dawn, the data gathering, and then I don't know, I from the response we're getting from the group, and it's up to the group and it's up to the SILC, but I think, Mark, if you had a chance to look at it a little bit more closely, because it is going to be a little bit of involvement with the CILs. And we will make time, Dawn, even though I think we're both working at capacity. This is very important to us.
It is important. And my concern is that we need to get this on the ball started if we want it to include data for our next state plan, because their timeline ends when our next state plan draft is due. Does that make sense? So we're on a really crunch time here. And
you're on it.
and
What's the time crunch?
I would recommend, because I believe our next spill draft is going to be due at the end of next June, like it usually is, in the fiscal year prior to it starting. So it would be due in fiscal year 27, which is next June, which is when this project would be up in a year and be done. So at the very last minute, we're receiving all the data from this needs assessment that we're going to be putting into our draft.
Okay, I understand what you're saying, and then it's not, as an ex officio executive director for a CIL, this is the only reason I take the freedom to mention this, but of course it's up to the SILC and the SILC members. if, I don't know if this is possible because I know you have to go through Nevada state law processes, but maybe if you could give maybe a week or two to the rest of the SILC members to review it, to see what they think, to get input, or take, take your vote today. I understand the time crunch, but Mark, any
Another,
input? Sorry, Jill.
I'm
I'm
sorry.
sorry. I'm at the wrong meeting. Don.
I'm sorry. I thought you were done for a second there. I was just going to say we can't wait until the next October meeting to decide.
Correct.
We would have to create another meeting, and it would have to be under open meeting law. So we're looking at pushing it at least a month if we don't decide now. And I know that's putting a lot of pressure on those who haven't been able to read it, but that's why I went through it, and I can easily read the details if you have more questions about it now. I'm just concerned that we want to get this moving because it's right at the timeline. Like, we need to start this if we're going to. And they've gone through the trouble of putting it together and at such a low cost. And I was really impressed with what they sent us.
Hey, this is Ace Patrick, for the record. Don, maybe looking at objective 3, can you pull up where it says objective 3 on page 5 and 6, I think? Because I'm looking at it right now, and that talks about the MOU. Will that clarify things maybe? So yeah, it's objective 3 on page 5 and then goes on to 6. It's right before they have oh, good Lord. Because
I don't see the page numbers on the
okay,
screen,
so it's
but
right where they've got, let me see.
I believe
Scroll,
I'm on it. So
yeah,
I
under
think
project narrative, right? Under project narrative.
oh, under the narrative.
Under project narrative, they have 1, 2, under number 2, under project narrative.
The goals, objectives, and deliverables.
Yeah, the project
I-
goal, objective, and deliverables, right? And go down to bullet point number 3.
Maybe I could just read all 3 of those
Yeah,
objectives.
yeah. Read those because number 3 talks specifically about the MOU.
Yeah,
If you
okay.
read those, sorry, I'm trying to.
That's okay. I'll read all 3 because that's the
Yes.
meat and potatoes, right? Those
Yes,
3
yes,
things are
yes.
the meat and potatoes of this whole needs assessment. So,
Exactly. Maybe this will help clarify some stuff.
okay, thanks, Ace. So, objective 1 is design a strategic assessment framework. BSCI, or Black Swan,
Yeah.
will collaborate with NV-SILC to develop a comprehensive assessment framework, detailed work plan, and accessible data collection instruments aligned with federal independent living priorities. Prior to primary data collection, we will deploy a, quote, validate then generate, unquote, sequence to analyze available administrative, demographic, and program data, including CIL suite service records, federal Section 704 performance reports, prior consumer surveys, and relevant census/ACS data, establishing a baseline and focusing primary research on the most critical information gaps. Objective 2, conduct accessible, meaningful statewide engagement. BSCI will implement a tiered accessibility-first mixed methods engagement protocol across all 17 counties. All tools will be built at a 6th grade reading level and fully WCAG 2.1 AA compliant to ensure meaningful participation from individuals with the most significant disabilities. Engagement methods include an online/paper statewide consumer survey, regional listening sessions, including an in-person session in rural and Southwest Nevada, virtual focus groups and key partner interviews, and targeted outreach through tribal nations and rural community partners. Objective 3, deliver actionable findings via the MOU feasibility framework. BSCI will evaluate all findings through a structured MOU feasibility framework analyzing 3 core domains: resource alignment, geographic reach, and operational compliance. This produces a county-level service gap inventory and data-informed recommendations to guide future planning, funding decisions, and resource allocation. Does that help? Did you guys get all that, or do you want me to repeat anything, or?
Yeah, I don't have necessarily issues with that. But the MOU, once again, is the issue. Maybe you could read the part that
Sure,
talks
I'll
about
read it again. Objective 3, deliver actionable findings via the MOU feasibility framework. BSCI will evaluate all findings through a structured MOU feasibility framework analyzing 3 core domains: resource alignment, geographic reach, and operational compliance. This produces a county-level service gap inventory and data-informed recommendations to guide future planning, funding decisions, and resource allocation.
Don, read the next part too.
Okay. Measurable outcomes include documented consumer engagement in all 17 Nevada counties, with at least 25% of direct engagement participants representing rural, frontier, or tribal communities, and a completed MOU feasibility determination within the performance period. So the MOU is actually part of how you would be data driven in your funding decisions as well as resource allocation. So that would actually also include, even if an MOU isn't necessarily required, what kind of funding is, right? That's what it sounds like to me.
Right, but I think we're confused because right now we don't work on an MOU basis. We work, our funding comes through the Department of Health and Human Services, the Administration for Community Living, um, Northern Nevada Center for Independent Living, and Southern Nevada. We've never felt the need for an MOU. We felt we were both doing the best we could. So that's the part that's confusing, and it's an MOU feasibility framework
So
analyzing 3 core domains.
what's interesting, Mary, is that I never said those words to anyone in the request for proposals. So they must have done their homework and researched our past meetings, our minutes, because I do recall you specifically calling it MOU feasibility. I know the feasibility word came up in our meetings previously where Lisa and you both were talking about that, using that word itself.
Yeah.
So I believe that they actually did their homework and looked up what we were asking for.
If I ever used the term MOU feasibility, it would have been from the materials that Erica McFadden had stated, and what Erica had stated, that the only time there's a need for an MOU is if it's decided between the 2 centers. And NNCIL and SNCIL, I do not believe we've ever broached the topic of an MOU. I believe the topic came up, and I know we did discuss it a lot prior to doing the last state plan, because at that time, I believe both centers were not in full agreement in establishing MOUs. And that's when we started researching the information. What causes the need for an MOU? And the need for an MOU is established by the Centers for Independent Living. And it's usually an MOU is developed between the Part C centers for independent living. So that would mean, like, if Mark said, Mary, you know what, we're really busy. Can you take Lincoln County? And I would say, Mark, you know, I'd love to take Lincoln County, but I need to hire a part-time staff person. So let me think, let me scratch my head and see where I could get the funds. Mark, can you give up part of your funding to help us to develop that? No, Mary, but let's work together. Let's find some funding. So is that
That's what they're doing, is they're looking at the MOU feasibility and they're going to make recommendations based on the data. And then they're
Okay.
going to tell the SILC, and then you guys can take that and do with it what you feel that it was best for you to do.
Yeah.
But then it'll also give us the tools to
Right,
go ahead
right.
and ask for more funding if there's gaps in areas that need it, right?
Exactly. And then my question, Don, and then if they did go back and they read our meeting minutes, did they discuss an MOU with you? Or did they just pick up, oh, this group really discussed MOUs, this must be what they want? It could be that they were,
Let me make sure I'm not telling you incorrectly, but I do have a copy of the RFP, which is also posted on our website. So that it could be that I'm not sure what was in our RFP exact. Shoot, it's not on my screen here.
because it could have been on the RFP about an MOU. And usually when you submit a bid for a contract, you follow the verbiage of the entity that's
Yeah, usually, but I don't think I put in that language, not specifically the MOU feasibility language anyway. But let me double check because I don't want to misspeak or, give you incorrect information here.
Thank you.
Here we go.
This is important for it's almost 3:30.
Yeah, I know. I didn't expect this conversation to go as long as it did because we do have some important things on our
Yes,
agenda to get
Of
through.
course, of
But
course.
there is absolutely nothing in the RFP about MOUs or about feasibility.
All
I
right.
just scrolled through it and there is nothing in the RFP. So that must have been them doing their research on what our past discussions had been about. That's all I can think of because that wasn't even in the RFP.
and like I said, we can't tell you guys what to do.
Right.
Okay.
This is just information.
I know Dee Dee and Randall have their hands up.
Yeah,
If we could let them ask their questions real quick so we can.
Did you was first, but
Okay, see you there.
can you keep it kind of short, Didi?
Sure, I'll keep it short and to the point. I don't feel that this is a proper evaluation when we are not included because whether or not they want to admit it, for the last, God knows, since 1998, we were formed, we have a board, we have a 501c3, we have everything we need. We have been operating as the Center for Independent Living,
Dee Dee?
and I realize we're not recognized.
No, Dee Dee, let me just interrupt you there. Dee Dee, this is Dawn Lyons. You are not being excluded. You are just not considered a Center for Independent Living, and that's according to ACL.
Well,
Yeah.
you know what, Dawn? We are a Center for Independent Living. We have been a Center for Independent Living, but we're not recognized. But that does not mean we do not provide services as a Center for Independent Living. And I realize that I'm the ugly stepchild that everybody wishes would go away, but I'm not going to because people need services. And we need to pull together and act like we are providing services. And that's what's important instead of all this other stuff.
Yeah, and I'm sorry that this is becoming an argument between the Centers for Independent Living and the Rural Center for Independent Living, because that's not what this conversation is supposed to be about. It's supposed to be about our needs assessment and the proposal that we've received.
And the needs assessment should include us because we are providing for people's needs out there. And all I got to say is that I have been bashed, I have been stepped on, and I have been treated horribly in a toxic work environment here. And I have held in here anyway because I believe the rural counties deserve to have services.
We have to go back.
Well, I don't think we've had enough time to review this. And I feel that all of us are being rushed into this.
Yeah, and I'm really
I'm
apologize for the timeline on this, but we didn't have even our funding information available to us to even decide to do this until just recently. So this was the quickest that we could have this turnaround, unfortunately, due to funding issues. So it's not even, it was even out of our hands, Dee Dee. No one planned for it to be this much of a crunch time, or, you know, for it to be this difficult or anything. It's just, you know, when the federal government shuts down, it causes a lot of delays. And so it's not anybody's fault, and nobody's being excluded from the data collection. Just so that everybody's aware, this is going to be a thorough needs assessment. According to the application, it is thorough. And I guess
it is not thorough because we are not included in the fact that we have been providing services to the rural communities since 1998.
You're not excluded, Dee Dee.
Yes. Where am I in there? Does it mention my name?
It mentions the entire community. They're going to reach out to every county. They're going to reach out to all the consumers. There's going to
I'm sorry, but I feel very much slighted and very much ignored. And I am really, really disappointed that they would do a needs assessment and not even consider Rural Center for Independent Living. And excuse me, I have no office staff to answer my phones. I have to answer it myself.
Okay, how about Randall, are you still there? You still have a question?
Well, I'm still here, but I don't really want to get in the middle of all that. But I mean, it seems like a lot of the hesitancy about this proposal is the MOU language. I mean, I do evaluations. I think that's pretty well put together. But I think you can also accept their proposal, but tell them you don't want all the stuff specifically on an MOU. You just want them to identify gaps in services, and they can say, you know, having all these MOUs might be one possible solution to that. There might be other solutions as well. But like, this is really just a data collection. I mean, this is really to help you get the data to inform your, and yeah, depending on what they find, maybe the SILC together will decide MOU is right. Maybe it's not the right thing, but like, I kind of agree. It's an unfortunate situation. Now the timeline is really tight, and it's not because of anybody's, at least not anybody here. But you're gonna need data to work with. So I think you can, when you accept this, I think you can give them some instructions on what to dive deeper into and what to ignore.
Thanks, Randall. This is Dawn Lyons. You know, you make a really good point. That's something that I can definitely talk to them about, and we can amend our motion to include, you know, that I will discuss with them to not include the MOU feasibility part in the report and just to provide that separately to the SILC so that so that the centers can make that decision privately, or not privately, but on their own with the SILC, and not have that be part of our whole report in our needs assessment, because that does make sense not to have that part of it anyway, if that's what they wanted. Mary?
Yes, Randall, thank you for the clarity. Sometimes it takes someone outside to clarify. As I said before, I reviewed the steps. I like where they're going with that. I would add some data expansion gathering, but that's me. But I feel that this would be a good proposal. Somehow they ended up targeting MOU. And Randall, what you said, an MOU might be one possibility. There's many possibilities. I believe that you use the word hesitancy. That's exactly where the perfect term for this. I believe there's a hesitancy because it states clearly that they want to work within the framework of an MOU, and by assessing the I can't remember, I remember the last word, three components of the services being provided, the in one being operational. But I believe my hesitancy is with the MOU, because I believe once we have the data, there are many ways that we might be able to go. So, Mark, what do you think?
I agree
And
completely with you. I mean, my trouble isn't with the data collection at all, of
oh
course.
yeah,
The MOU wasn't added in the proposal either, so I don't know where they got that from. But I think if we could modify it, make an amendment on this proposal, I'd be willing to go along with that. Or if you could talk to them, Dawn, and direct them as to our offer or
Yeah,
our desire.
I can absolutely do that. Julie, is anyone else on the SILC? Everybody agree that I can state an amended motion that we're looking for? What, Julie?
Page needs to accept the amendment to the motion.
Okay. Then let me go ahead and restate. I'm looking for an amendment to the motion to include a discussion with Black Swan about the removal of MOU language from the report and to discuss other options. Based
Point of
on-
order, and not to be pedantic here, but I think Ace would need to withdraw her motion first before you can make an amendment.
That's what
Okay. Oh, okay.
that's what I was trying.
This is Ace. I have a question regarding that. So does this mean they're going to have to go back and rewrite it? And then because, they're going to have to go back and rewrite it, right? And change the language. And that means this is then going to have to come up for a vote again. I mean,
I think we could state it right here.
Yeah, I don't think it's necessary for it to be rewritten other than, for them to just do an addendum to it later and that it's stated in our amendment.
I'm not an attorney, but I think that, yeah, the minutes of this meeting would act as a way to do that. Since this is involving money, we should probably be exactly right about it. But
Do you think I stated that well enough, Mark?
yeah.
Okay.
You stated.
As soon as Ace rescinds her amendment, right? Or rescinds her motion.
Yeah, just withdraw the motion you made so we can just move on. We have to take back what you said because we're like halfway towards one thing and we need to go back and just redo the amended version.
Okay, got it. Okay, this is Ace Patrick for the record. I rescind my motion.
Thanks, Ace. This is Dawn Lyons. I would like to propose an amended motion to accept the proposal with the stipulation that the language of MOU feasibility be eliminated from the report in the end, and that other possibilities are considered. Ace, would you like to say so?
Wait a second.
I'm sorry, what, I missed that, what, I,
Did you want me to restate the motion?
yeah, please, because I'm just thoroughly confused about
Okay,
this whole
I would like,
complicated
I would like
thing
to
right
propose.
now.
Okay, Ace, you ready? I would like to propose an amended motion to accept the proposal with the stipulation that the language of MOU feasibility be eliminated from the final report and that other possibilities are considered.
Okay, this is Ace Patrick, so I would agree with that, so I would second that.
So you're making that motion?
So moved.
Thank you.
Need a second now, right?
Yeah, I think,
Okay, we need a second now.
I second.
thanks, Julie.
And in the interest of time, I'm gonna call them up. And I think we should do a roll call.
I think you're right. Okay, let me hold the roll up. All right, if you agree, say yay. If you disagree, say nay. And if you abstain, say abstain. Julie Steinbach?
Hey,
I don't.
yay.
Margaret Marcucci?
Abstain.
Ace Patrick?
Yes.
Dee Dee Formaster?
Abstain.
Mark Tatter?
Yes.
That's it. So we have 2 abstentions and 1, 2, 3 yays.
It's Randall, remember?
What'd you say, Julie?
It's Randall, a
Yes.
member.
Yes, we have three yeses and 2 abstentions, and so that would make the motion barely pass, yes.
Okay. It passed. Can I please ask? I know that we're all busy people, but when there's something as important as this, I beg of you to read before the meeting.
And I do apologize, Julie, that I wasn't able to post it any sooner than I did. I posted it as soon as I received it.
Yeah. Okay. The reported. And we've got it to come with public comment. So I don't know what you want. I'm not sure what to do.
Actually, can we skip to agenda item number 12?
Yeah.
Did you say yes?
Yeah.
Okay, thank you. I'll go ahead and read it if that's okay, Julie.
Yeah, please.
So this is Dawn Lyons, agenda item 12 for discussion and possible vote on next actions anticipated for day 2. Discussion and update regarding the Rural Health Transformation Program and the Barrier Removal Fund Grant Program, and possible vote on SILC initiatives and or potential collaborations. I wanted to talk about the Rural Health Transformation Program a little bit, but first I would like to bring your attention to a document that I just received from Idaho. It's public comment on the proposed changes to the guidance for federal financial assistance. It's a federal action, and public comment is due by Monday. So I wanted to make sure I squeezed this in somehow, and it does seem to fit under possible vote on SILC initiatives. So it fits under this agenda item. And if I know you didn't have time to read it, but it's really about the proposed changes, including a lot of really sketchy ideas about who will make funding decisions and why, and it gives a lot of well, according to Idaho anyway, it could result in reduced effectiveness of statewide IL services, reduced stakeholder engagement, limited spill implementation capacity, barriers to coordinate emergency preparedness, housing, health, and transportation access, and potential loss of federal funds due to restrictive compliance interpretations. And so since I posted it as a material, I know we don't really have time to go through the whole thing now, but based on those points that Idaho has made, I find it concerning as well for all SILCs nationwide, including us, that maybe we would like to add our public comment to the list of public comment that's been submitted by Monday, and that I could go ahead and use Idaho's template and rewrite it according to how it affects Nevada and go ahead and submit that. What are your thoughts on that, you guys? Randall?
So I just want to clarify this. I mean, this impacts all federal funding. So it's pretty wide thing. So at the university, I'm very concerned with all of this. So I think what Idaho outlined is really well done for independent living services. And that's a good place to start. So I would like to see as many people, including so submit something as they can. And it's just really worrisome. These rules say things like any federal funding can be terminated at any time for any reason. Says things like we can't use our money for rent, which is very concerning to me because we do rent out spaces and we don't have space for people. So where are they going to work if I can't use federal money for this? So I just think it's important to realize that this is a very broad thing. It's not up to Congress to vote or anything. It's just rule through OMB through their standard grants management practices. This is going to have much bigger impact, and people just are not giving this the attention it needs.
Yeah, I agree, Randall. Thank you. And I would appreciate any input that you would like to contribute. And even if the SILC doesn't agree that this should be public comment from the SILC, I would go ahead and submit public comment personally on this, just because it is very serious. So yeah, I would love your input. Margaret?
I agree with Randall. I read it and was just totally appalled at what they could and couldn't do. And that's just giving the federal government too much power over what we do and what we use our money for.
Mary?
Thank you. I read it as well, and it's surreal. Some of the statements in there it's taking us back almost to a dictatorship. When they say that they can cut funds from any program they want without any question, without any warning, and they don't have to explain. That's what the statement implies. My concern is I really have been expecting something from Nickel about this because it's been out for a while. And Randall, I think you're right. I don't think it's getting the attention that it needs. Thank you.
So here's my thought on this, because it is, again, once again, it's a last minute type of thing, and we don't have a whole lot of time to ponder on this or take consideration as to how we want to approach or whether or not we want to provide public comment, right? So it's kind of like either we decide today or I just do it on my own, right? Because that's what I planned on doing regardless. But I would love to have a message from our council on public comment on record. So the problem is I did not have time to write it yet. So I was thinking if I use this Idaho state as a template and just change it according to Nevada's laws, and then consider anyone else from the SILC's input that they would like me to include, like Randall, like he said, or anyone else on this council who would like to email me their input. And I can incorporate all of that into a letter, and whoever has input, I can send out the final draft, and everybody that added some to it can approve it, and we can submit that public comment accordingly before the deadline on Monday. If this council would give us the authority to do that, I would be very grateful.
I think it's important that Nevada SILC make a statement. So I would support
This is Ace. I agree with Julie. I would support that as well.
This is Margaret. I would support it too.
Great, thanks. So I guess could I get a motion to allow myself to draft public comment and submit for this guidance before the deadline on behalf of the SILC?
I'll make the motion that you get to whatever you just said, darling, because I agree. We have to do it. Yes.
This is Ace. I second that.
Any more discussion, or can I do a roll call vote?
Call the question. Go ahead.
Okay, Julie Steinbach,
it.
Margaret Marcucci,
Yes.
Ace Patrick,
Yes.
Dee Dee Formaster, I'll come back to Dee Dee. Mark Tatter,
Yes.
Dee Dee, are you able to unmute to vote? We'll just consider that an abstention. One abstention and all the rest were yays, so it does pass. Did you want to say anything, Julie? Or?
Advice is standard draft.
Okay, great. Thank you, everybody. I appreciate that. And we have 5 minutes left, Julie, if you want to call, if you want me to read the preamble for public comment.
Yeah. Please.
Okay. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the beginning and end of each day and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments.
Well,
Is it Chun?
Audio unmuted alert.
Yeah, can you guys hear me?
yes.
Okay, I just want to very quickly say hi. I'm actually zooming in from Austin, Texas. So, have a nice time because it is 6 o'clock here. I'm gonna have to run. But anyways, you guys did a wonderful job at this meeting, and as always, just for fun, keep it weird.
Thank you, Chun.
Yes.
Thank you, Madam Chair. Stephen Cohen for the record. I'll keep it brief with the time crunch. We have one of the most important legislative sessions coming up. I thought that was kind of pretty clear yesterday. And I think October will make that doubly clear because we'll have more tangible information by then. But we need to stop the fighting. It's that simple. The consumers are frustrated just as much as the staff. But we need to stop the fighting and work together, all of it, everybody. Thank you.
Yeah. I was gonna say something really similar. We are family and we need to work together. And personalities, conflicts have no place in this meeting. And I look forward to future productive meetings. Dee, I think we're gonna run out of time.
Maybe Ace.
Hey,
Yeah.
hey, real quick.
Yes, hi, this is Ace Patrick for the record. Real quick, I just wanted to say that we had some productive spill work groups. We tabled another spill work group until we had more input from the in-person spill meetings that we'll have and one that will be virtual. So I hope everybody, when those happen, I hope that everybody shows up if they can and give their input into our spill and the hard work that we're trying to do with that. Thank you very much.
Okay. I'm gonna call this meeting adjourned.